go ahead and get started. It's a little bit after 6 o'clock. So before we begin the formal program, we have several interpreters here. We need to see if the interpreter services are needed. So Martha, I'll ask you to address the group first.
Mi nombre es Marta, estoy aquí para servirles. Si alguien necesita traducción, va a poder decirme. Gracias.
I need help interpreting that.
We'll take questions after the presentations, gentlemen.
Tôi tên là Idria O. Nếu có ai trong phòng này cần thông dịch viên á, là cho con biết là con thông dịch. Cảm ơn.
So since we do not believe that there's anyone in the audience that is either going to need Spanish interpretation or Vietnamese interpretation, we're going to ask our interpreters at any time if you would like to leave, that would be fine. As far as the sign interpreter, it appears that we don't have anyone that needs sign interpretation, and you're free to go then also. Okay? Very good. We appreciate that. Before we get into the program, we're going to ask two of our elected officials, two members of our Commissioners Court, to come forward and to welcome you. So, Judge Whitley.
I do want to welcome you this evening. I'm glad that you came out. I hope that you'll feel free to ask any questions as the presentation is going on. We're going to ask the questions as we go on, or are you?
Either way is fine.
So if you have a question, be sure to either jot it down and so you can ask it, or just raise your hand as we're going along, and we can kind of move through the process. But again, we're very thankful that you came out this evening, and we hope that we can answer your questions. Thank you very much for being here.
My name is Andy Nguyen. I'm Tarrant County Commissioner of District 2. Welcome everyone to the Tarrant County Sub Courthouse in Arlington. It's been a long journey, over 2 years for us to assess the healthcare needs in Tarrant County, and we are now at the final steps toward the very first step of a much longer journey. And those of you who have been with me during the past 2 years, I want to thank all of you, especially the members of the Precinct 2 Healthcare Advisory Committee. And I know there's some faces in this room who have been working and helping me in assessing the healthcare needs and to make sure that the needs of our citizens are met. Can you please stand? So the purpose of tonight is for you to ask any questions you may have at all regarding the proposal. If you have questions regarding finance, regarding health care, regarding mental health, about anything related to this proposal, now is a great opportunity to do so. If you need to talk to me and my staff, you know how to reach us. Our office is upstairs on the 3rd floor. Again, thank you so much for being here, and please sit back, put on your seatbelt, and be really excited.
And before we get into the program, I'd like to introduce one additional person. This gentleman sitting to my right is Robert Early. Robert is the Chief Executive Officer of the John Peter Smith or Tarrant County Hospital District system. And what Robert will be doing is, if there's a question that comes that we can't answer initially, I'll ask Robert to address the audience on that. I would also like to point out that on your seat, there is a card. And the card looks like this. It's a quick facts sheet. And it does two things. First of all, it gives you the elements of what the bond package is. And second of all, which I think is just as important, at the very bottom of the back page, there is a website. It's the Tarrant County website. And on the front page of the website is an icon that says Tarrant County Hospital District Bond Election. If there are questions that we need to do further research on that you asked tonight, then we will post those questions on our website along with the answers. Also, those questions and other questions that people call in and ask about the bond package will be posted on the website. So we update the website at least weekly. And so we encourage you, if you want to find any additional information as it relates to the bond package, then please visit the website. And as Commissioner Wynn said, if you want to speak to the commissioner, his office, or the county judge or his office, please feel free to contact them. So I'm going to be your main presenter tonight. My name is G.K. Mania. I'm the county administrator for Tarrant County. And we have 10 slides we'd like to go over with you. But there's something that everyone needs to realize. This is an educational forum. This is not an advocacy forum. We are not either being an advocate either for or against the bond program. Our goal tonight is to simply educate you. And so if you have questions, please feel free to ask them. So what I'm going to do, we're going to go on a little story to tell you some history as to why we're here tonight. Several years ago, the hospital district began to plan a bond package because of the need to update the facilities at the district. And as part of that bond package, what we did, we came out and spoke with people like you. In fact, some of you were in those audiences, where we explained the bond package or what we thought that the district needed. And during that process, we found out that the citizens said, yeah, that was good, but we need more. And so we pulled that process down, and we began to expand how we were going to find out not only what the district needed, but also what the citizens of Tarrant County were asking for through its hospital district system. And the Commissioners Court created what was called a Blue Ribbon Committee, the Citizens Blue Ribbon Committee. Some of you that I see in the audience have been attending those meetings. They were made up of 10 private citizens of Tarrant County, and each appointed by the county commissioners and the county judge. And then there were representatives, liaisons if you will, 2 from the Hospital District Board and 2 from the Commissioners Court. Commissioner Wynn served as one of those liaisons to that particular committee. And that committee went and studied the healthcare needs of Tarrant County for almost a year. And they were very diligent in their meetings. In fact, it was kind of interesting about the Blue Ribbon Committee itself in that it was made up of a very diverse group of people. And so those individuals came from different socioeconomic backgrounds, different political backgrounds, and I think personally there was a great cross-section of the county. And so they met, and they worked very, very hard on this. We gave them 2 tasks. We said, first of all, what we would like for you to do is to try to evaluate what the medical needs of Tarrant County would be. Not just for JPS, but for the entire county. And there's a reason for that. Tarrant County is one of the fastest growing counties in the United States. We currently have over 2 million people. We anticipate within the next 20 years that population will be well over 3 million people. And we wanted to make sure that not only if we had the ability to provide medical services, but also how those services would be brought forward. And also if there was a better way of keeping our community healthy. And so we asked the Blue Ribbon Committee to look at that process. And then we said, okay, as you look at that process, tell us what you think or what role JPS will play in delivering those services. And they did. And in February of this year, the Blue Ribbon Committee came forward to both the Commissioners Court and to the Board of Managers, and they made their presentation. And there were 5 elements that we're going to talk about tonight. that they unanimously believed were essential as far as the role of JPS in the provision of health care. And so with that, the Commissioners Court looked at how we could structure something like this. And during the process of the Blue Ribbon Committee, we had two nationally recognized consulting groups help us. One was to help the committee through the process of evaluating healthcare needs, and the second one was to take those recommendations and then to price the cost of those recommendations. And that's what we did. And so at the end of the day, there were 5 major areas that the committee unanimously agreed that the county had to focus on. And the total cost of if we would have built everything brand new, and that's important, brand new, would be approximately $1.2 billion. Now that's a lot of money. We all understand that it is. And so with that information, we handed this back to the Commissioners Court, and we began to analyze several things. We began to analyze, first of all, the financial aspects of these programs. And we knew immediately that the $1.2 billion was something that we had to build everything brand new. And so we wanted to make sure that we became flexible enough to look at different ways of accomplishing the recommendations of the Blue Ribbon Committee at a price somewhat less than the $1.2 billion. And we think that we can. And at the end of the day, the Commissioners Court voted unanimously, and the Board of Managers of the Hospital District voted unanimously, for those that were present and voting, to support a bond package with a value of $800 million. And in that bond package, the Commissioners Court was very clear on a couple of different things. First, and most importantly, the Commissioners Court was not going to authorize the expenditure of any debt if it resulted in a tax rate increase. So this bond package is a no tax rate increase bond package. We also knew that you can't build all the buildings at the same time. And the Commissioners Court charged us with looking at building this in a 10-year period. And that's important to know, because one of the other requirements was that we were going to ask the hospital district over a 10-year period to bring forth an additional $300 million. Now, when we say that we're looking at a $800 million bond package, that's an amount that we want to have authorization to spend. That doesn't mean that we're going to go out and sell $800 million worth of debt, because the responsibilities of people like Mr. Early and myself, through the guidance of the Board of Managers, and more importantly, the Commissioners Court, is to find a more effective and efficient way to deliver the recommendations of the Blue Ribbon Committee in a price that is less than that. In that, we're going to talk a little bit tonight about how we might do something like that. But the bond request is for $800 million, which gives authorization of the Commissioners Court to spend up to that particular amount. So when you look at this slide presentation, the bond package is being called for in November. It's November 6th. Early voting is October 22nd. And it will be a proposition that will be after the candidacy elections. So it should be right at the bottom of, actually at the top of all the other propositions, but right below the individuals that are running for political office. We did have public input. That's the Blue Ribbon Committee that we talked about. There was the assessment of the current and long-range needs. And then I will tell you that this process, since the Blue Ribbon Committee started, was about an 18-month process. And the committee worked extremely hard, staff worked very hard, and the end result is our request to the voters. So, the $800 million improvement bond package, it's not going to increase the tax rate. The Commissioners Court was adamant that that would not occur. So one might ask, so what kind of track record does the Commissioners Court have when it relates to bond packages and not increasing the tax rate? Since 1998, the Commissioners Court has authorized 2 different elections, and for a total of almost $550 million. And the same restrictions were placed on those packages as the Commissioners Court has placed on this. And at the county level, that process has been managed. There has not been a tax rate increase because of this. And in fact, the Commissioners Court has lowered the county's tax rate 4 times since that point. And in fact, the last 3 years, the Commissioners Court has lowered the tax rate by approximately 4% each tax year. So they have not only held the tax rate, but they have also decreased the tax rate. As it relates to the hospital district, the hospital district's tax rate has decreased, and it's the intent of the Commissioners Court to hold that rate as it moves forward with this bond package. One of the things that a lot of people may not realize, but when you look at the hospital district's revenue stream, it's a big operation. And only about 40% of the revenues that it takes to operate the hospital district actually comes from ad valorem taxes or property taxes. The rest comes from either direct payment by insurance, Medicare, Medicaid, grants from the federal government to address specific health issues, and other revenue streams. But the important thing is to realize that the district only gets about 40% of its revenues from the taxes, from property taxes. So, our commitment to a no tax rate increase goes like this. This is going to be a pay-as-you-go bond program, which will have oversight by the Commissioners Court. And let me, a lot of people may not understand exactly how the budgets are set and the tax rates are set when it comes to the hospital district. The Commissioners Court appoints all 11 members of the hospital district's Board of Managers. And the Commissioners Court sets the budget and it sets the tax rate. And for those of us who've been around a long time, I will tell you that the Commissioners Court is very, very clear that the budget that the district brings to us and is scrutinized by the board and recommended by the board, that we hold the district responsible for staying within budget and stay within the revenues that they have received or anticipate receiving. And I've been doing this for about 30 years now, and I will tell you that the district has held true to that, simply because they know that they don't want to go in front of the Commissioners Court and try to explain why they overspent their budget, because that, in my mind, would be not a very good day to be in Commissioners Court. So it's important to know that not all the bonds will be issued at the same time, and that we anticipate that once we begin this process, that we will actually, in some areas, be able to save money. And you say, wow, how does that work? Let me give you an example. One of the most urgent needs in this county is additional treatment of mental and behavioral health. It's interesting when you think about that, because I bet you if we looked at this audience, you either know someone or someone in your family who is in need of some type of mental health treatment. We simply don't have enough facilities. We don't have enough to the point that even those individuals who seek treatment at the hospital district for mental health related issues, that we simply don't have enough beds. And if you look at the cost of the hospital district maintaining a inpatient bed compared to what we have to pay to when we send those individuals to a private institution, it costs us approximately $150 more per day. So the package that the Blue Ribbon Committee recommended would expand the behavioral health facility. We anticipate that the revenue that we would save by being able to treat these individuals in-house rather than having to send them to a commercial site, that we would save approximately $9 million a year. Now that's true savings. That's not money that you bring in, that's money that you don't spend. And in my books, whenever you don't spend money, that's almost as good as the amount that you bring in. And then finally, something that we talked about earlier, this is not just about JPS. This is about positioning JPS in a bigger picture on how we develop a healthy community, if you will. And Commissioner Wynn has been very strong in pointing out that we need to focus on healthy communities. And there's part of this package that does this. It is much more efficient and it is much less expensive. If we can treat our citizens in the community rather than our citizens coming to the emergency room, that is the most expensive care that you can deliver. And there are elements in this package that provide those type of services. Just want to give you some facts about JPS and the hospital district, something that a lot of people may not know. Every 2.5 seconds, a patient need is cared for by the hospital district. The hospital district has not held a bond package since 1985. And quite frankly, when you look at some of the facilities that the district has, you can understand that the last bond package was 33 years ago. Our population since '85 has grown by 1 million people, and within the next 20 years is going to grow at least another 1 million people. As I said, this county is one of the fastest growing counties in the United States. The important thing to also remember is that the demographics of those individuals are going to change. Our population is going to get older, and they're going to need health care and a specialized type of health care that JPS is poised to provide. This is something that is really a two-sided sword, or two-edged sword. Tarrant County, the hospital district is the county's only level 1 trauma center. It's great because if you're in a serious accident, if you've been shot, if you have a serious heart attack, the place that you can guarantee to go where you're going to have a doctor standing ready to help you, the only place in this county that guarantees that is the hospital district. The downside on that is that, unfortunately, there are so many times that people need those services. And every time a police officer is shot, every time a firefighter is injured, every time there's a serious accident, this is the place where they go to get treatment, because they know when they hit the back door of JPS, those specialists are going to be waiting for them. That's what a level 1 trauma center is. There's 3 of them in Dallas, but there's only 1 in Tarrant County. We talked a little bit about mental and behavioral health needs. Currently, we only have the ability to treat about 37% of the people that need mental or behavioral health services. Patient treatment is increased by 77%. A lot of people don't realize this. John Peter Smith is Tarrant County's primary training facility for local doctors, nurses, and other healthcare professionals. We have the largest family practitioner. How many long, Robert? Residency program in the United States. Here's something you ought to try. When you go and visit your primary care physician, ask him where he or she did their residency. Probably did it at JPS. The interesting thing about residencies, and I believe you have 12 different specialties with residencies, is that 80% of the doctors who do their residency in a particular location, geographic location, stay in that location after they finish their residency. We're opening up a new medical school. It's going to be important. More importantly, with the increase in population, there is going to be a dire need for not only doctors, but also other healthcare professionals to treat people like you and I. And so this is how the package is styled. It's one of the things that I wanted to draw your attention to on the information card. The wording of the bond package is there. It's in blue, and that's how it will appear on the ballot. So the priorities. I said that the Blue Ribbon Committee came up with 5 priorities. And here they are. We need to expand mental and behavioral health facilities in this county. We need to update our hospital facilities, not only to provide better treatment, but also to provide a better educational experience so that those doctors can graduate and become our doctors. We need to update our Level 1 Emergency Trauma Center. Cancer treatment is something that the community was very vocal about. We need new cancer treatment centers. We need to expand those. That's what this bond package does. Within the bond package, there are 4 new regional community patient care facilities, community health centers. One of the things that we heard every time we went and did a listening session was that there was a need to have clinics throughout the county. The district itself has 14 clinics, somewhat like this, but not as comprehensive as these are going to be. And the reason that there was a real desire to have these clinics out in the community is because of the lack of transportation to get to downtown Fort Worth if you needed to use some of the JPS facilities. Arlington has a facility now. They're scheduled in this to pick up another one, a larger one. The Commissioner's Court was very clear that they wanted to look at what services are going to be provided in these clinics so that we can provide health care locally to our local community. And then we wanted to update and expand our ambulatory outpatient surgical facilities. So what does that mean? That means that if there are some surgeries that are not life-threatening, because of the limited number of surgical suites that we have in the hospital, those surgeries may have to be postponed, even up to the point that you're just about ready to go into surgery. We can do that type of surgery at a lot less expense if we do it in an ambulatory care, and you see a lot of this in other hospitals also. So, the election is November 6th. Early voting is October 22nd. If you have questions, you'll be able to ask any of them now. Or if you have questions that you would like to submit to us that you don't want to ask now or think about later, then you'll be able to go to our website and you'll be able to, and we'll take those questions, we'll answer those questions, and we will put them back up on the website for not only your consideration, but also other people's consideration that visit the website. Our website is www.tarrantcounty.com, and on the front sheet or the front page, we have an icon that says Tarrant County Hospital District Bond Election, November 6th. All you need to do is click there. It's fairly easy to navigate. If people like me can navigate that thing, you all are not going to have any problem navigating it. So with that, that's our presentation to you tonight. As I said, this was an educational forum. It's not an advocacy forum, but we'll be more than happy to attempt to answer your questions if you have questions now. If you do have questions, if you would just simply come up to the microphone and just state your name, and then we will ask those, or we will try to answer your questions. Questions? Yes, ma'am.
Hi, I'm Marty McGee. I'm an Arlington resident. The stats here are saying that currently we're only serving 37% of our county's inpatient mental and behavioral health needs.
Yes.
What percentage do you anticipate will be served once assuming the bond passes?
Okay, so it'll not be 100%, because we rely on services not only from a public hospital, but also from the private hospitals. And we believe that with the growing population, that number will probably move to about 40 to 45%. Hopefully, if we can, but what our strategy would be to have intervention type facilities, maybe located in the clinics, where that a person would not have to actually go into the hospital, but we could treat those individuals as an outpatient. Our goal is eventually 50%. And we're working with our other partners who are private providers. Hopefully they'll be able to help us on that also.
So there will be a lot of focus on outpatient care as well.
Yes, ma'am.
Thank you.
Yes, ma'am. Other questions? Yes, ma'am.
I think I know the answer to this question, but I'm not sure, so when in doubt, ask. I heard you say a number of times that it's very expensive for a person to come to the emergency room.
Yes, ma'am.
And that you could, on these regional clinics, it would be less expensive. Why is it so expensive at the emergency room? Both of them seem like an emergency to me.
So let me ask Robert to, Robert, would you like to take that question?
Sure. Part of the reason it's so expensive is you have a full quadrant of people that are sitting there, and people that come into the emergency room are usually in their more difficult situations. It's episodic, so you're coming in one time and then you go somewhere else. The key is your primary care is a huge answer for American healthcare, because if we begin to see disease earlier, whether it's diabetes or cancer, then you result in a much more efficient way to deal with that patient population. So your emergency room is usually more expensive for what is all there. It's there to solve everything that's possible. So if you're in a primary care setting, we're going to catch it earlier. We're going to catch it at less expense than a stage 4 cancer or some of the other challenges that we have. About 41% of our emergency rooms throughout Tarrant County are overutilized. People come in for the wrong reasons. They come in for their meds or whatever. So it's a bit of a challenge. And I think if we had better primary care or stronger primary care, not only from a convenience standpoint, from a cost effectiveness, it would make sense. Thank you very much.
Thank you, Robert.
You bet.
Hi, my name is Lee Barrett. You had mentioned earlier about services in the community to promote a healthy community. What kind of services were you considering or thinking about for the bond package?
In the area of a healthy community, we would be asking JPS and our public health department to lead an effort with the other healthcare providers in developing better methods of education to how to stay healthy. We have a tremendous amount of outreach at the public health department, but we believe that it needs to be expanded. We need to engage the other hospitals and medical care facilities in promoting health in and of itself. And the delivery of the healthcare system is going to change. You know, right now, for example, if most people wanted to go see their doctor, then they would make an appointment and go to a bricks and mortar type facility, a building, and see their doctor. I can tell you on my cell phone right now, and believe me, I am not technologically advanced. You can tell by the small screen, okay? But I have an app where that I can talk to a doctor within 10 minutes. And if it's a minor deal, like I have a sore throat or a minor emergency, they can give me guidance on my cell phone on how to treat that. In fact, they can actually call in a prescription for me if it's an antibiotic. Educating that and moving forward with those type of techniques. But really it becomes more of a social aspect, you know, where you have areas that have adequate food and healthy food, and a community that lifts itself up, that realizes that being healthy is more important than letting things go and finally getting sick. And that's a messaging aspect also. But it's not anything that any one jurisdiction or agency can do. The hospital district has to play an important role because they touch so many different lives. The other healthcare providers have to do the same thing. And we're going to ask public health to coordinate that with the other hospitals and with JPS to move strongly in that particular area. We have to think more of being healthy than what to do than when we're sick.
Mr. GK, Mr. Early, Judge Woodley, and Commissioner Wynn. I'm Chaplain Stoglin. I am a proud resident of Arlington, Texas, and a veteran. And I think there are several veterans of us in the room. Raise your hands. There are Marines that I've had to deal with. 11 combat tours, Mr. GK. 77 months of combat. And unfortunately, they are going to come back here, and many of them are not ready, and some of them are already homeless and drifting. And your hospital and this proposal will help them because they need to go somewhere to get help. Mm-hmm. And there may be those who don't understand that, but for us veterans, it's heartbreaking. And I just want to embrace that because we have got to deal with that. We've made a promise to these veterans and their families. And this preventive care, the mental health piece, I like all of this plan, but personally the mental health, because it's prevention and responding. So if you could talk a little bit about that, because that's, to me, very critical, not only for veterans and their families, but for this county. Thank you.
So let me start by saying that the delivery of mental health services in this county is not isolated with one jurisdiction or one entity. The bricks and mortar aspect, the hospital and outpatient treatment is done at JPS, but our mental retardation of Tarrant County is a large organization that provides mental health services to a large number of people in this county. Now, when it comes to veterans and homelessness and things such as that, there was an article in the Star-Telegram last Sunday. I think it was Sunday. And in fact, it was front page. And what it showed was a volunteer. It wasn't actually a volunteer. It was an employee of John Peter Smith Hospital that was going out to the homeless population and giving them wellness checks, and it was a great article. It showed us how we take care of people that are in need. The veteran population has become a larger growing concern in the homeless population, because it's not just the fact that they're homeless, but 77 months or 11 tours is way too much. way too much. Vietnam, it was 13 months. World War II lasted 4 years. And our soldiers have been in combat or in a combat condition or situation for a lot longer than that. And it takes a mental toll. And so John Peter Smith is working in the homeless coalition or the homeless community to identify those at the county level, and I know at the city of Arlington and the city of Fort Worth, we are trying to, and we have offered and have the ability to offer shelter and housing for veterans. It's never enough though, because we have a tremendous number of veterans who are coming back to our community that are in dire need. We need the mental health services for those individuals. And by the way, most of those individuals can't pay. And they did a lot for us, and now it's time for us to do something for them. Yes, sir.
Dennis Kelly, Arlington, Texas. Mr. Early, I think that you should expand on what JPS is doing for the homeless. A lot of people don't know this, but JPS goes out routinely with teams to visit homeless camps.
Yeah.
And it just makes a big difference to those people. So you want to say a few things about that?
Yes, sir. Thank you, Mr. Keeley, for that. We have now a team of nurse practitioners that go out to homeless encampments, under bridges, out in the community where homeless populations live. And the reason we started that was back to your initial question about the expense of an emergency room. Unfortunately, we were taking people and hydrating them that collapsed on the street at 110-degree temperatures in the summertime who were homeless, came into our emergency room, hydrate them, and send them right back into 110-degree temperatures and see that cycle and circle continue. So our nurse practitioners began to go out and make exams underneath bridges and where those homeless encampments are, which reduced the number of patients from that homeless community coming into our emergency room. And that was significant. And that's what Mr. Mania alluded to. Mr. Joel Hunt is one of our nurse practitioners with some incredible teams of people doing that. And that's going to be our answer. And that goes to your question about what are you doing in the outreach. It's putting in navigators to help people understand what they should be doing at home and how you can help yourself and how you get mold out of your air conditioning units like the judge in the commissioner's court did on asthma and efforts like that. That makes a big difference. That's the healthcare we're going to see in the next 20 to 30 years. Thank you, Mr. Keeley. I appreciate it.
I have a couple of questions. The first one, and I'm all about how government spends its money and how much money they spend and how deep they get into the voter, citizen taxpayer pockets. How much cash does JPS have on hand right now?
Let me try to answer that initially, and then I'll ask Robert to also answer that. The district has a policy that they need to keep a certain amount of operating days cash, and that is 250 days, I believe. And the burn rate at the hospital district now is a little over $1 million a day.
Yeah, 1.3.
There you go. You knew the answer. So
well, I know the answer, but
I understand. No, I understand. I didn't mean it that way. There's some extra monies that have been set aside. 2 years ago, the hospital district created a future fund, and monies that were revenues that they brought in that they didn't expend. They moved it over to the future fund to start building a reserve, if you will, for capital improvements, building buildings. And so that fund has probably about $125 million somewhere in it. And I believe that when you include that, there's probably another 150, 200 million on top of that.
And so roughly JPS has $1 billion in cash, and there's reasons for that $1 billion.
I don't believe it's $1 billion.
Yeah, it's real close to it. And my concern tonight, the county is fat. It has more money than it knows what to do with, and it's obvious. The bond money is non-recurring, and it's just pocket change to the county. What I'm concerned about is 20 years ago, JPS Network operational costs were around $400 million a year. Today, they're around $1 billion a year. What are they going to be 20 years from now? And this is the recurring cost that the taxpayers pay every year.
So let me start by saying this. 20 some odd years ago, the population of this county was half of what it is today. So we've had an additional 1 million people that have been added into as part of our citizens. The need for health care has gone up. If you look at the cost of health care, the cost of health care has gone up dramatically. For those of us that go to the doctor or need, and if you don't have insurance, then that health care is going to be even more expensive. And so when you factor in inflation, when you factor in some of the newer services because of the different demographics of the population, then you'll see that rise from $400 to $1 billion over 20 years is probably pretty much in line. Now, when you make a comment like the county is fat with cash, Tarrant County has, of the big 6 counties in this state, we have the second lowest tax rate. If you add the hospital district into that, we have the lowest tax rate of any big county in this state. When you look at the amount of money or the number of employees that we have per the number of population, we have the lowest number of employees for our population. When you look at the dollars that are spent per employee, as far as it relates to our general population, we spend less per citizen than any other big county in the state of Texas. There is a program that's run by the state that evaluates the efficiencies and effectiveness of counties in this state. We have been recognized as one of the most efficient, one of the most effective counties in the state of Texas. Not just small counties, not just medium-sized counties, not just big counties, but all counties in the state of Texas. The value that you contribute through your taxes to this county are well spent, in my opinion.
Last question. The recommendation from the committee, the Blue Ribbon Committee, was $1.2 billion worth of cash was needed.
That's correct.
And we're going to float a $800 million bond. Are we going to bill out to $1.2 billion, or what are we going to bill out to?
Okay, so you bring up a good point. I brought it up initially, but let me try to respond to that again. What the county is seeking on this bond proposal is authorization to spend up to $800 million. We hope we never hit that, because we believe that we have strategies that we'll be implementing over the next 10 years that will get us to the point that we will accomplish those things that the Blue Ribbon Committee has recommended, but still stay under that $800 million. So the promise that the Commissioner's Court has made to the citizens of Tarrant County is, if you give us this authority, we will manage your money conservatively, and we will try to do what we can, be creative, be efficient, and be effective on how we run these projects to ensure that we can accomplish what the Blue Ribbon Committee has recommended and not have to go to the entire $800 million. The problem is that type of planning, that type of exercising or execution is not something that you calculate up front. You calculate that over a 10-year period. Yes, sir. It's good to see you.
Thank you. Dave McElwain, Arlington. My question is, how does the hospital district go about collecting the cost for medical care for those who are, number one, in the country illegally, and number two, as I understand it, some of the surrounding counties also use the hospital district, Parker County, Johnson County, and Ellis County. So how do they go about collecting from those other counties and also from the illegal alien population?
I'll answer at least part of that. When you begin to go west of Tarrant County, you have a lot of smaller counties, and they don't have the type of medical services that we have here. So if there's a significant illness, they are going to actually come into our emergency room. We have found, and Robert, please correct me, but the emergency room, through insurance that we get, because it's mainly automobile accidents or things such as that we actually make a little money on that. The problem that we have is that if someone presents themselves to our emergency room, it doesn't matter where they live, it doesn't matter what their legal status is. By federal law, the hospital district is mandated to provide services to them. So we have to provide those services in the emergency room. Now, I know that Judge Whitley and the Commissioner's Court have reached out to these smaller counties and have said, you know, if you're going to send your citizens over to us for medical treatment, you need to really start thinking about how you're going to provide a revenue stream.
But
it's pretty difficult to get it out of some of the counties, but we're trying.
To my recollection, this problem's been around for over 20 years.
It's been around
a long time.
Yeah.
It's not something new.
Well, quite frankly.
In the case of the illegal alien population, I taught ESL in this county for over 15 years. And some used to come back to my classes and brag about how they got free medical care at JPS. Now, I got problems with that where my tax money is covering the cost of people that, number one, are in the country illegally, and number two, they don't even live in my county. They don't pay any taxes here. So I got problems with that. The other part I got problems with is debt for local government oftentimes becomes addictive. Besides this bond issue, Arlington's got 3 more bond issues on the ballot. And it becomes addictive. We got Detroit that went into bankruptcy. You got Puerto Rico went into bankruptcy. You got a couple of cities in California. And once you get started, debt becomes addictive. It never ends. So back to my problem with the surrounding counties and how do we collect from them. I question just how serious an effort's been made to collect from them things, because this is not something new. This is an old problem. And I just don't like the idea of my tax money subsidizing Parker County, Johnson County, Ellis County, and whoever else is involved, plus a lot of foreign countries as well. Thank you.
Hi, my name's Hunter Brown. I'm an Arlington resident, and I do support this bond, but I had a couple of questions.
Yes, sir.
Actually, 2.
Okay.
One of those is the 4 regional medical centers that you talked about in here.
Yes.
Are those going to be based on geographic regions, or is that going to be based on areas of need?
Actually, it'll be both. Okay. When we talked about earlier about some of the national consultants that we brought in, we brought in a part of that group was demographers that looked out in the future and tried to see where some of these sites might be located. While I can't tell you exactly what address it's going to be built at, but I know that currently that these will be placed in, I believe, one in each of the commissioners' precincts, and it'll also be based on need.
Okay. And then my second question is, there's a fun fact on here about every 2.5 seconds a patient need is cared for.
Yes.
That seems kind of vague. Could you elaborate on what that is? Is that every time a patient's admitted, or is that every time a nurse checks on a patient? What does that mean exactly?
Robert, do you want me to answer that, or do you want to?
I'll begin by telling you that JPS sees 1.2 million patient encounters in a year's period of time. So, and those patient encounters can consist of everything. It can be the need that we have in our school-based programs with children's program. It can be the needs that we have in the 2 emergency centers that we have. And we do have 2 emergency centers. We have a psychiatric emergency center, and we have what one would consider your more standard emergency room type facility where you would go if you're hurt. So if you equate that to sort of looking at how many patients we're going to see and how many we have, equates to about that many per second. And all the encounters that you're going to get at JPS for everything from diabetes all the way to neurosurgery on down. And we're all inclusive. And to your first question, Mr. Manias is exactly right. It's based on need, but the needs in all 4 of those precincts are pretty significant. And if you just look at your backyard and what's happening over here in Arlington and Mansfield and Cannondale and that area and the huge increase in population, the smartest thing for JPS, bond or no bond, is to make sure that we have the best access you can possibly have. And the best way to do that is put that in the epicenter where those populations are most needing that care. And that's what JPS will look at.
I never got my question answered. How do you collect from the illegal population and also the surrounding counties? I never got that answer.
If a person is an undocumented person, then those individuals are treated like an out-of-county resident, and they are charged.
Do you collect?
To a certain extent, yes. So out-of-county, we do everything that we can legally possibly do. We've raised this issue at the state level with no response from the legislature. We've talked with the leaders in those counties. And basically, it all goes back to, if it gets to the point that it's an emergency and they present themselves to the emergency room, it doesn't matter if they can pay or not. By federal law, we have to treat them. And that's as good an answer I can give you.
Have we ever considered sending a bill to the county commissioners of those counties? Send them a bill.
We have.
We would definitely, we have considered that, and we have effective.
20 years worth?
I don't know if it's 20 years worth, but I think we've got effective leadership that can have one-on-one conversations with those county judges and those other county commissioners. But we're going to work on a self-pay, as Mr. Mania said. They're going to come into the emergency room, and then after that, they're a self-pay patient. And we do everything we possibly can to aggressively try to get those bills paid.
Back to health care.
Thank you.
I'm standing here before you believing that we have a crisis at an epidemic level of mental health. I am president of East Arlington Renewal. At one of our meetings several months back, we had our chief of police, and the first words out of his mouth is, "The greatest challenge to law enforcement is mental health." This month, we had Tarrant County Sheriff. First words out of his mouth, verbatim. The greatest challenge to the sheriff's office is mental health. I would like for, and this is directed to him.
Yes, ma'am.
I would like for you to walk through with me and my good friends here, what is the process of handling the mental health component of your job? How do you do that? Walk me through all the process, and then tell me how effective you are.
Yes, ma'am. There is going to be a certain percentage of patients that we receive in mental health that are going to come in on bench warrants. They're going to come in by the police officers and law enforcement officials that see somebody either being disruptive, lost on the street, do not know, or are not coherent enough to answer what their name is or anything else like that. They will be brought to JPS. We will take those people and try to assess their situation best we can, stabilize them best we can. The toughest challenge is JPS lives on two ends of the platform. the platform of emergency care where you have seconds to save a life, and mental health where you hope you've got 30 years of a partnership with somebody taking their medications so they can get through each day. So the tough part is trying to deal with those patients that are bench warranted into JPS and trying to deal with those. Those are oftentimes challenging because they're aggressive and not wanting to take their medications. We try really hard to do that. Effectiveness, it's hard. Got to have a partner to do it, but JPS is a good place to do that. I will tell you, as a taxpayer here in the county and a taxpayer yourself, the jail is not a mental health institution. And it is an ineffective way to spend our money when you take somebody off the street who is a mental patient and you put them incarcerated in a jail. It does absolutely nothing except cause challenges for our law enforcement officials. So JPS is the place for that, and JPS needs to look at figuring out the best way we can to not have the highest population of mental health patients in our county jail. That's why you heard that from the chief of police and our sheriff, both incredibly great leaders at dealing with that. The second part of our population are the people that are manic depressant, the people that are bipolar or schizophrenic. They oftentimes take their medication, but they may waver off that for whatever reason, and they will voluntarily come to JPS. And they will say, I don't feel right. I don't think I'm doing well. I need more help. We'll provide counseling, and we'll provide them either a review of their current medications and whether they need additional medications for that. That's a population where you do create an initial partnership with. The third aspect, though, I would argue to you, is what we start to see in our school systems. People who are bulimic or anorexic or cutting themselves or have issues with who they are and where they are, it's not something that's slight anymore. It's significant. And the quicker we deal with that at 11 and 12 years old or 10 years old, the better off we're going to be long term. So those are the three major areas that JPS has. We at JPS see 1,500 to 1,600 psychiatric patients a month. Yes, ma'am. And that number has increased. It's a tough challenge for us. It's a tough challenge to find the providers that we need to make sure that we're doing that, particularly in adolescent psychiatry. And that's to speak to Mr. Mania's point. We have a residency program for psychiatric teaching, and we hope that we can teach more and they'll stay in our community. I appreciate your question, and it's a real concern to mine. Yes, sir.
I'm a retired school teacher and go to a lot of the school board meetings. One thing that's caught my attention is the need of juvenile mental health. Now, with this mental health facility, are they going to make a strong wall, so to speak, between the juveniles and the adults? We're not going to have mixed juveniles in with adults, perchance, are we?
No, sir, we don't have that now, and we won't have that in the future. Good question, thank you.
Good evening. I'm Judge Matt Hayes, and gentlemen, I appreciate the opportunity to ask questions. I'm one of the people who sends folks over to see you periodically on emergency mental health warrants. And I have a number of people that I see over and over because their wife, their dad, their adult child is a danger to themselves or to other people. And the question I get asked regularly is, what can I do? We recognize the part I work in is a Band-Aid. It's not a fix to the system. Mm-hmm. As we develop more help in the mental health area, will we see that in the regional centers where there's going to be some local help that we can point people to, or there are some other strategies where we can provide resources to the family of the people that we're dealing with?
First of all, without being patronizing, Judge, I knew who you were when you walked in the door, and thank you, because I don't think people realize what you go through. I don't think people understand what a magistrate goes through with the really, really tough issues you have to deal with and the heartbreaking nature of that issue that you deal with. So thank you. Second thing, to answer your question, everything. Everything possible, including telemedicine, including anything we can possibly do to stop that cycle. If you go into JPS's 10th floor, our psychiatric emergency room, and you begin to ask those young people and adults the questions, there's almost a pattern to every one of them. There is abuse at various levels, there's alcoholism, there's drug addiction, there's all types of problems. So it's multifaceted. Anything that we could possibly do is good. The challenge is, and you know it perfectly well, It's dealing with the civil liberties of an individual that says, I don't want to be here. I'm an adult. I can leave. That's a challenge for us. It's a challenge for you. And then, unfortunately, we have the manifestations of trouble out in our community. I will tell you that you've got 4 county commissioners and a county judge who are more dedicated, and I've lived in other counties and seen policy being made. I think you got 4 county commissioners and a county judge who are incredibly dedicated to mental health, and I've never seen better magistrates in this county anywhere else. So I appreciate it. It's heart-wrenching and it's gut-wrenching to deal with those issues. Thank you.
One last comment. JPS is a tremendous asset to Tarrant County. Absolutely the best people in management that you can find. They could go to other hospitals and get paid a lot more. As I said, I'm concerned about the dollar spent, but from a standpoint of service, JPS is second to none.
Mr. Keeley, I will tell you that you and I have been on the same side and opposite sides on issue, and I will tell this community and the place you live, I appreciate you, and I appreciate the fact that you come to our meetings, you keep us honest, you ask the hard questions, and you compliment when you think we do well. So I appreciate that.
Other questions?
How are y'all? I'm Bill Eastland. I live in Arlington. I wanted to go back and ask a question regarding the source of revenues for the hospital district. Of course, we know that as you stated before, about approximately 40% comes from the property tax.
Yes, sir.
That's a taxpayer contribution. But aren't there other revenue sources that come from tax dollars? And I'm talking about several different sources, and that includes Medicare and Medicaid. So my question is what percentage of JPS revenues do come from other tax sources besides the property tax?
I'll give you ballpark figures, but 40%, as you stated and Mr. Mania stated, comes from property taxes. About 40% of our money comes from federal pass-through dollars, which I would think the bulk of that would be related to tax dollars. And about 20% of the additional, or what rounds out everything else, comes from commercial payers or our own efficiencies. Now, in the last 2 years, I will tell you that we have seen reductions in the federal tax dollar that comes through. I have our finance chair here as well, but correct me if I'm wrong, we've received about $40 million less in the last 2 years in federal monies that come through to JPS. And a lot of that money from the federal government is a state pass-through dollar. It goes through the state, but that's just the process of it. So that gives you a ballpark figure. It's 40, 40, and 20.
Right. So this is predominantly a taxpayer-supported hospital, obviously. And of course, you also do have mandates, and then you have unfunded mandates.
Yes, sir.
But one thing I'm curious about, I know you all have adopted basically a policy of going on ahead and continuing to follow Obamacare, and you've got the 1115 waiver. And so basically, in spite of the fact that the state government chose not to join, we have in Region 10, and I think that's happened probably in other regions across the state. So my question is this: what if in the future, let's say that the election goes a particular way this fall, and the Republicans finally have the votes to pass complete repeal of Obamacare? How will that then affect your operations? Or alternatively, let me say, Texas and 19 other states have sued based on the fact that that we have now taken away the individual mandate by law, and they have sued to go back to that previous decision, saying now all of Obamacare would be unconstitutional. So either the Supreme Court could say it's unconstitutional, or we could get a law that repeals Obamacare. how would that affect y'all?
I will tell you that when I became the CEO, I had no idea that there would be any Affordable Health Care Act, if we would have one, if it would be ultimately repealed or changed. I don't want to be trite with your question because I respect it, but whatever comes through that and hits our front door, we're going to deal with. I don't know exactly how we would deal with it. If it's totally repealed, we'll deal with it. I heard all kinds of rumors when the Affordable Health Care Act came into business. I heard that we weren't going to have a reason to exist anymore because everybody would have insurance. So there's all kinds of different levels. So I honestly can't answer your question, but to tell you, we're as nimble and as agile as you can possibly be with whatever federal or state guidelines that come our way. And the 1115 waiver was actually an answer to the opposite of Medicaid expansion. We, as you well articulated, we're not a Medicaid expansion state. We're one of 11 states that aren't. But that was a state-sanctioned 1115 waiver. That was state support for their options not to do other things. And we certainly, as well as the other counties in Texas, were supportive of that and supportive of that process. But what comes our way, we'll deal with it. And we're not in the lobby game. Whatever comes our way, we will deal with. I can't truly answer as to what the ramifications will be because I had no idea what the ramifications of the Affordable Health Care Act would be, nor the manifestations or the changes of it since it passed.
Well, if I might make an observation, you said that even when the Affordable Health Care Act passed, you all felt like that, or some people said, well, then everybody will have insurance, right, and everything will be different. And obviously, that hasn't happened, right?
Right.
We still have a mess. The other side of this, though, is I guess I'm trying to come back to the promises that are being made for this election. And one of those promises by our Commissioners Court, and I know they honestly say this, and I think that they intend to keep the tax rate low and not to increase it. And of course, I do understand that, because of the schedule of selling bonds and everything, you can go into the future and not have an increase in the hospital district tax. But at the end of the day, if these other parameters change, if, say, Obamacare changes, or even a federal law regarding Medicaid were to change and things like this, you all may have dynamics that could lead to pressures in the future that would also actually cause tax increases. I guess what I'm saying is the current Commissioners Court can't bind future Commissioners Court in a promise not to raise taxes. So it could happen in the future. I'm not saying it will, I'm just saying it could.
Well, I'm a big believer that you elected those county commissioners, and I don't think the attitude of this county is going to change very much. So I have respect for who's there, and I have a lot of respect for who's going to be there, and I don't see those changes. But thank you.
I hope you're right.
I appreciate it. Thank you very much.
Okay, thank you. One more question related to finance. Does the hospital district receive any money at all from the state?
I couldn't say no. We receive some money from the state. Most of it is a federal pass-through dollar, but we do receive state funds as well for various programs, and those are going to be in grants and in other places as well.
5%, 10%, roughly, rough estimate.
I truly don't. I couldn't tell you because the reason I pause on that is because many of that dollar is a pass-through dollar, and sometimes I'm not even aware if it's fed or state, so I don't know, and I would not want to give you even a ballpark figure because I don't want to be wrong.
We'll research that and give you the answer.
Happy to.
I will tell you that that the county is a recipient of funds, and both from the state and the federal government, such as the Ryan White Act, such as Department of Health and Human Services at the state level. And we contract out with various entities to provide services through that funding. And the hospital district is one of those entities that we contract with.
Okay, so let's say Health and Human Services sends a case over to the hospital district for mental health, for example. Since they sent them over, do they send over a check with them, or I mean, do they help fund some of that?
That's pretty easy to answer. The answer is no.
They don't. Okay, not ever. Okay.
Not in my lifetime.
All right.
optimistic, but
Okay, and the second question I have is there any time on record when any of the surrounding counties have ever sent Tarrant County a check and say, hey, we really appreciate what you guys do. Here's a check for $1 million for being a nice guy. Has that ever happened?
not to my knowledge.
Not in my 31 years, but
if it
we'll take
does
it.
happen, I'm calling you first and letting you know, because I would be delighted.
Thank you.
Other questions? Okay, we're going to ask Judge Whitley and Commissioner Wynn if you would like to make some comments as we close.
I'm good at that age tonight. Again, I want to thank you for coming out. I want to thank you for the questions that you've asked. I want to say to you that I understand and I am sometimes as frustrated by who presents and how they present. And I will tell you, we've heard many discuss tonight the need, mental health. And I will absolutely tell you that there is not a check large enough to cover all of the need that we have in this community or any other community. And what we have to do is we collaborate and we work together. We work together with the Mental Health Authority. We work together with THR. We work together with Cooks. We work together with Baylor All Saints, with Medical City. Folks present themselves in the emergency rooms. I will tell you, I know of a story. I do know that at one point in time, Dallas County sent a bill to Collin County. Collin County judge sent it back with a stamp on it, and it was not a postal stamp. And it said, no, we're not paying. Now, that's a conversation that we need to have with our state. Every county is required to spend a certain amount of their budget on health care services. And they normally do that by contracting with physicians, with hospital groups, with folks within, if they don't have a JPS, they do that by contracting with physician groups or ways to show that they spent that percentage of their budget. But we do know that folks end up in our emergency room because of mental health issues from as far as Erath, Palo Pinto, and other counties. And when they show up in the emergency room, again, as Mr. Early and Mr. Mania mentioned, we are required by law to see them and to treat them regardless of their status as a citizen, regardless whether it be of Tarrant County or whether it be of this country. We work very hard to spread and to provide as much service with the limited funds as we have. And please hear that even with what we're proposing, we know that we're not going to provide all of the care needed. But we hope that we can continue to work on a better way to provide the care to make it available to more folks. But we still know that we're going to have to depend upon the other nonprofit and for-profit hospitals and agencies. Tilly's back there. She does a tremendous amount of work within Arlington, within this community, to help folks out. And our goal is to try to spread that out as much as possible. As Mr. Early mentioned, we don't know what's going to happen next week, next month, next year, or the next decade as far as funding. We have to just find a way to make it work with the limited dollars that we have. And as a court, we limit those dollars. And we wish, there are times when our hearts break because we limit those dollars. But at the same time, we know we can't just open the floodgates. So it is a tough balance. Steve Montgomery is on your hospital board. I can tell you it's a tough balance for him. He served 2 tours of duty on that board. And when we ask people to do that, I can tell you they come in with one perspective and they see what's going on and they understand what a hard challenge it is sometimes to figure out how to sparse out the limited dollars that we have. And so I appreciate very much you coming and trying to understand and asking the questions that you have. And I want to encourage you to continue asking those questions and continue to be involved, because I think it's a result of that you will feel better about what is being done with your tax dollars. And at the same time, we might grab you and get you in, and you may actually begin volunteering. And I bet you Tilly can find a place for you to volunteer. She said there, she's there at 5 in the morning. If you want to come over, she'll be more than glad to put you to work. Thank you again very much for being here this evening.
What you just saw is basically what I consider the physical component of JPS. It's a tangible component, the buildings, the facilities. We need to expand the capacity due to the increasing demand on our healthcare network system and mental health system. But there's another component that is intangible, that is very complex, even for Mr. Early to understand, is how do we build a culture of wellness, a culture of health within the population of Tarrant County, which is expected to be at about 3 million in 2035 or 2040. We know that we cannot build big enough buildings to house all of our healthcare and mental health problems. We know there is no way that we can afford to build a big enough buildings, and I say again, to house all those problems that we are expecting to come in the future. The only way is we have to work together in a preventative way to make sure that people take their health in control, they take ownership of it. When they have to call a doctor or check into an emergency room, it's a bit late. How do we get all Tarrant County residents to focus more on the preventative side? When we are able to achieve that, that is when less pressure will be placed on JPS facilities, less pressure will be placed on JPS doctors and medical professionals and personnel, and that is when we will be able to slow down the increasing cost of healthcare. That's the only way. There's no magical formula to it. Tonight, you only saw the physical component of the overall solution. The other component is a lot more complex. It requires us working across various jurisdictions, Tarrant County Public Health, JPS Health Network, MHMR, Tarrant County Mental Health Connections, and so on and so on and so on. And working across jurisdictions may sound simple, but it's not, because every organization has a certain way of doing things. And how do we get people to drop their guards, to come together and embrace this great challenge of the 21st century, which is healthcare? If you talk to any of your state reps, they will tell you the cost of healthcare is about to exceed the cost of education in Texas, and which is true, 100% true. And how do we deal with it? Keep building bigger buildings? That is not a solution, and you know that, and I know that. So the real solution to this is to expand the capacity, but that is a short-term solution. The long-term solution is for us to work together across jurisdictions to build a culture of health in Tarrant County. And the only way for us to do that is to think outside the box. Years ago, you elected me to watch out for your tax dollars. You elected me to think outside the box, to push against the status quo when necessary. And I can tell you, beyond any doubt, and you ask any gentleman in this room, including Mr. Early, Mr. Montgomery, and so forth, that I have pushed back against the status quo. I have asked very hard questions, even at times that made me a very unpopular person. I did that. So to my voters, to my bosses in Precinct 2, I have looked at the needs at JPS for 2 years, not just one day, but for 2 years. I have visited the needs of JPS, And I concluded the needs are really, really there. Further, I assessed the future needs of healthcare in Tarrant County and the future needs of the population that JPS serves. And through multiple reports and assessment and white paper, if you go to my office, you will see thousands of pages that I spent late at night reading. And through that 2-year period, I have affirmed that the challenge of the future is greater than the challenge today. That means we have to do something differently. And lastly, I have spent a lot of time with Sharon Clark, the CFO at JPS. And I have questioned her financial reasoning, her financial logics. And finally, I concluded it's going to be tight because JPS is operating on a very tight margin. For every dollar that we expend at JPS, we only get back about 60 cents from the federal government if we're lucky. So would you get into a business for every expenditure of $1 of expense, you only get 60 cents back and you lose 40 cents? No, you wouldn't, okay? But because of that tight operating margin, okay, we have to vet JPS financials very closely, and we did that. Judge Whitley is a CPA. And if you have not worked with Judge Whitley, he looked at every little tiny bean, okay? So from those 3 aspects, the future challenges, the needs of the facilities, and the fiscal side of this proposal package, I can tell you with full confidence that this is the right thing to do. I know this is not about advocacy tonight, but I have the responsibility as your county commissioner to inform you and to educate you that I have done my job, that I have done my homework, that I have done my due diligence, okay? And now I'm placing this proposal into your hands. And you have the right to make up your own mind of how you're going to vote in November. And thank you so much for your presence here tonight. And I hope that we will continue to work together to deal with the challenges of healthcare in Tarrant County, regardless of the result of this bond election in November. Thank you and good night.